What do you think the building blocks of a healthy community are? Health is not just the business of healthcare professionals, it's our business too. Health is everyone's business. We all play a role in shaping our community and can influence how easy it is for people to live a healthy life. So let's start a conversation about where and how health happens and hardly mention healthcare at all. We all know about the health problems in Australia, and our Loddon-Campaspe region is no different. Across regional and rural areas such as ours, people can expect to live on average for 3 years less than people living in some metropolitan areas. Each year, there are over 10,000 preventable hospital stays due to conditions like diabetes and chronic lung disease. That's more than one admission every hour of every day that could be prevented. We think we know what contributes to these problems, things like obesity, poor diet and lack of exercise. Across our region, the Active Living Census survey found that 63% of residents are overweight or obese, 86% of residents don't eat enough vegetables, and 43% don't do enough physical activity. But do we really know? Have you ever stopped to think about why some of us have a poor diet or don't get enough physical activity? Let's meet Sam and start to think about some of the whys. Sam has ended up in the emergency department, not for the first time, seeking help from a healthcare provider. Sam has diabetes and high blood sugar levels again. Sam missed a few GP appointments at the community health centre. Why? Sam has too far to walk to catch the bus, and the footpaths don't feel safe to walk on with unsteady and swollen feet. Sam has no one to get a lift from and little support. Sam doesn't have a driver's license anymore, and family and friends stop dropping by now they can't get a lift to places. Sam's eyesight from diabetes isn't great, so it lapsed, and running a car is too expensive. Why? Sam doesn't have a job after being unwell and missing too many shifts. Sam hasn't managed the diabetes all that well, particularly early on. Why? Sam's never known how to cook, and healthy food seems expensive. Sam would like to try, but is feeling a bit low and alone. Stories like Sam's are not uncommon, but we don't often think of the complex range of factors that led them here, the why. Through the Active Living Census, local people told us about their health and well-being and the barriers they face to being more physically active and eating well. We looked at how health and well-being was experienced across the community and how these barriers varied among households in different places, with different levels of income, and for people with different levels of education and life satisfaction. One of the things the survey revealed is that a large proportion of people who report low life satisfaction, which is associated with poor mental health, don't meet the guidelines for physical activity. But it also revealed that these same people would like to be more active. After hearing Sam's story, what do you think might be getting in the way of people with low life satisfaction being more active? People who reported low life satisfaction told us that accessibility, cost, and lack of social support are some of the things getting in the way. How about our employment circumstances, our income, and the availability and cost of food? Do you think this has an impact on our diet? The answer is yes. The Active Living Census found on one or more occasion, nearly 1 in 10 households in our region ran out of food and couldn't afford to buy more within a 12-month period. And in some areas, this increased to 1 in 5 households. Our circumstances, our family, our friends, and our community all have an influence over our health and the choices we make, such as whether we participate in physical activity, how much we do, and where we access it. Our diet choices and our mental well-being are influenced in similar ways. So, can you see the shift in focus? We're talking about things beyond healthcare and hospitals, and beyond our individual behaviours. Now we're talking about education, income, transport, local infrastructure such as footpaths, community services, access to food, employment. We're talking about the building blocks of good health. These are not the things that the healthcare system deals with, but we do. There is no doubt healthcare is important, but it's also expensive. In 2017-2018, healthcare cost us $185 billion. That's 10% of all government spending. And it's rising every year. It's just not sustainable. We're at a fork in the road. So why not take another direction towards well-being and equality? Let's put away our band-aids and look at how we can all play a role in shaping a community where it's easy for everyone to live a healthy life. We can choose to focus on making sure everyone has access to supportive and inclusive communities, a secure job and a fair wage, nutritious food, a good education, safe and affordable housing, great walking and cycling paths, social connection and support, opportunities for exercise. So, with this in mind, let's rewrite Sam's story. Sam feels great. Sam lives in a community with a local government committed to thinking about well-being and fairness in every decision it makes. A local government that creates walkable neighbourhoods, that makes it easy for people to access parks, healthy food and clean, safe streets. Sam has a caring employer with flexible working arrangements, good friends to turn to and ways to connect with community. Sam can access local organisations that offer affordable programs and free local health and diabetes support. And Sam knows there are excellent healthcare providers available should they ever be needed. So, what does this mean for you and your role? Health is our business. Health is everyone's business. We can improve our community's health because we're engineers, planners, builders, food workers, teachers, parents and carers, artists, local government councillors and employees, accountants, students, volunteers, because we all help shape our community. So what can you do in your role to make a difference, to help shape our community, and to ensure the building blocks of good health are in place?